If you have noticed your waistline expanding despite eating the exact same way you have for years, or if you find yourself crashing hard after lunch every single day, or if you feel like your brain just is not working like it used to, struggling to find words or remember names, then there is a very good chance these are not random isolated problems. They are not just bad luck. They are not simply signs of getting older that you have to accept. They could be connected. And that connection point might be something called insulin resistance, a condition that affects nearly 1 in 3 people in the United Kingdom and the United States, and yet most of us have never even heard of it until we are diagnosed with type 2 diabetes. But here's the thing that changes everything. By the time that diagnosis comes, insulin resistance has typically been quietly damaging your body for years, sometimes decades. It has been linked to heart disease, fatty liver, dementia, and even certain cancers. And the frustrating part is that most standard health checks will tell you you are completely fine right up until you are not. Hi, I am Dr. William Lee, and over the last decade, working in emergency departments and researching metabolic health, I have become fascinated by the patterns that separate people who age well from those who do not. I have seen the same metabolic patterns show up again and again in patients who come in with seemingly unrelated complaints, and they are often preventable. And so I want to share the insights I have gained over the years with you, the kind of information that in today's busy healthcare system, doctors simply do not have time to discuss during a 15-minute appointment. So today I'm going to walk you through 9 signs of insulin resistance. These are not obscure symptoms that you would never notice. These are probably things that you are experiencing right now, possibly dismissing as normal aging or just being busy. Some of them are visible on your body. Some of them are feelings that you have after meals. And some of them will show up on blood tests that your doctor might have already told you are within normal range. What matters is recognizing the patterns, because insulin resistance does not announce itself with one dramatic symptom. It builds gradually, affecting multiple systems at once. And if you catch it early, it is very often reversible. So before we get into the 9 signs, we need to understand what is actually happening in your body when insulin resistance develops, because without this foundation, the individual symptoms will not make much sense. So insulin is a hormone produced by your pancreas, and its primary job is to act like a key that unlocks your cells and allows glucose from your bloodstream to enter and be used for energy. After you eat, your blood sugar rises, insulin is released, the glucose gets moved into your muscle cells, into your liver, into your fat cells, and your blood sugar comes back down. That is how it is supposed to work. But with insulin resistance, your cells stop responding properly to insulin signal. The key still fits the lock, but the lock has become stiff and unresponsive. Your cells are not letting glucose in as efficiently as they should be. What happens next is the critical part. Your pancreas, detecting that blood sugar is not dropping quickly enough, starts producing more and more insulin to compensate. Now, for a while, this seems to work. Your blood sugar levels stay normal or close to normal, which is why standard glucose tests often come back fine. That is really important. But you are now living with chronically elevated insulin levels, a state that we call hyperinsulinemia, and that excess insulin causes widespread problems throughout your body. Eventually, your pancreas simply cannot keep up with the demand, and that is when blood sugar starts to rise and type 2 diabetes is diagnosed. But the damage to your blood vessels, to your liver, to your brain that has been accumulating for years and years before that point, now that is our foundation. So the first sign of insulin resistance is one that you can actually see and measure. And this is fat accumulating around your abdomen, even when your overall weight has not changed much, or when you are not necessarily overweight by BMI standards. This is not about body image or aesthetics. Central fat, which is the kind that sits around your organs rather than under your skin, is a metabolically active tissue. It releases inflammatory substances and interferes with insulin signaling in a vicious cycle. One of insulin's roles is to regulate fat storage. And when you are insulin resistant, insulin levels are chronically elevated, which actively prevents your body from breaking down stored fat. At the same time, excess insulin promotes fat storage, particularly in the abdominal area. So you end up in this trap where fat is easy to store but difficult to mobilize. What makes this particularly insidious is that you might notice your trousers getting tighter around the waist while your arms and legs look the same or even thinner. You might step on the scales and see a stable number, but feel completely different in your clothes. That is because fat distribution has shifted. Your waist circumference becomes a better marker than your weight. In men, a waist measurement above 37 inches, and in women above 32 inches, starts to raise concern regardless of what the scales say. This is not about vanity or even looking good. Visceral obesity is one of the strongest predictors of metabolic disease, and it is often the earliest visible sign that insulin resistance has taken hold. Research from the National Institutes of Health confirms that waist-to-hip ratio is a more accurate predictor of cardiovascular risk than body mass index alone. When you carry weight in your middle, it suggests that your fat cells are overwhelmed and spilling fat into organs like the liver and pancreas, directly impairing their function. This is why two people can weigh the same but have vastly different health risks. The location of the fat matters more than the total amount. Moving on to something that you feel rather than you see, which is overwhelming tiredness after meals, particularly after eating something carbohydrate heavy like pasta, like rice or bread or anything sugary. Most people have experienced this at some point and written it off as a food coma, assuming it is just a normal part of digestion. Well, it is not. What is happening is a dysregulated glucose-insulin response. When you eat carbohydrates, they are broken down into glucose, which enters your bloodstream rapidly. Your pancreas releases a large surge of insulin to deal with it. But because your cells are resistant, your body overshoots. The insulin surge is bigger and lasts longer than it should. Eventually, that excess insulin drives your blood sugar down quite sharply, sometimes even below where it started, creating what is called reactive hypoglycemia. Your brain, which runs almost entirely on glucose, suddenly finds itself undersupplied. That is when the fatigue hits, along with difficulty concentrating, irritability, sometimes even shakiness. The whole process, which is the spike, the overcompensation, the crash, all of this happens within 1 to 3 hours of eating. If you find yourself needing a nap after lunch or reaching for coffee or something sweet mid-afternoon, your body is telling you that your glucose regulation system maybe is not working smoothly. In someone with good insulin sensitivity, blood sugar rises gently and comes down gently without these dramatic swings, and you feel steady energy throughout the day. Dr. Mark Hyman, a leading functional medicine doctor, often describes this as being on a blood sugar roller coaster. You go up high and then you crash low, and that crash is what drains your vitality. It is not laziness, it is biology. Your cells are starving for energy despite there being plenty of fuel in your blood because the door to let the fuel in is stuck. Now this brings us naturally into the third sign, which is feeling hungry again surprisingly soon after eating a full meal or experiencing intense cravings, particularly for sweet or starchy foods. This seems counterintuitive at first. You have just eaten, your stomach is full. You might even feel uncomfortably full. Yet, within an hour or two, you are searching the cupboards for something else. The problem is that hunger is not just about stomach fullness. It is about whether your cells are actually receiving and using energy. With insulin resistance, glucose is sitting in your bloodstream, but it is not efficiently entering your cells, particularly your muscle cells. From your brain's perspective, your body is starving even though you have just consumed plenty of calories. So it keeps sending hunger signals trying to get you to eat more. As well as that, insulin resistance disrupts the normal signaling of satiety hormones like leptin. Now, leptin is produced by your fat cells, and it tells your brain when you have enough energy stored. But chronically elevated insulin interferes with leptin signaling, creating a state called leptin resistance. Your fat cells are screaming, "We are full." But your brain cannot hear them. The result is that you feel perpetually hungry, you eat more, your insulin levels stay high, and the cycle continues. People often blame a lack of willpower when they struggle with cravings. But this is a physiological problem, not a character flaw. The hunger is real. It is driven by broken energy signaling, and it will not resolve until the underlying insulin resistance is addressed. Studies published in the journal Obesity have shown that high insulin levels directly block leptin transport into the brain, meaning your satiety center is effectively blinded. This is why willpower often fails in the face of biology. You are fighting against your own hormonal chemistry. Number 4 takes us back to something you can see, but this time it is changes happening to your skin. And there are 2 classic signs worth knowing about. The first is called acanthosis nigricans. It appears as darkened, thickened, velvety patches of skin, most commonly on the back of the neck, in the armpits, or in the groin. Now, some people think it is dirt and try and scrub it off, but it is really not. It is a skin response to chronically elevated insulin. Now, insulin at high concentrations can bind to growth factor receptors in the skin cells, causing them to proliferate abnormally. The result is this distinctive darkening and thickening of the skin, and it is a marker that your insulin levels have been running too high for too long. The second sign is multiple skin tags. Now, these are small, soft, flesh-colored growths, often on a bit of a stalk, that appear around the neck, in the armpits, in the eyelids, or under the breasts. 1 or 2 skin tags might be incidental. They are quite common, but if you are developing multiple ones, particularly in clusters, then it is worth paying attention to. The mechanism is quite similar. Excess insulin stimulates skin cell growth in ways that are not supposed to happen. Both acanthosis nigricans and multiple skin tags are visible external markers of an internal metabolic problem. They are common enough that they are often dismissed, but they should not be. If you are noticing these changes, it is your body giving you a clear signal that something has shifted metabolically. Dermatologists often see these signs before endocrinologists do, because the skin is such a large organ that reflects internal health. Ignoring these skin changes is like ignoring the check engine light in your car because the car is still driving. It might drive for now, but the engine is under severe stress. Moving on to sign number 5, which is biochemical this time, and it is something that only shows up when you have a blood test, but it is incredibly telling if you know what to look for. Most people focus on total cholesterol or LDL cholesterol because that is what gets all the attention. But insulin resistance creates a very specific lipid pattern that often flies under the radar. Triglycerides go up and HDL cholesterol, often called good cholesterol, goes down. You might have blood test results showing LDL in the normal range, and your GP tells you everything looks fine. But if your triglycerides are elevated and your HDL level is low, then that is a red flag for insulin resistance. This pattern reflects what is happening in your liver, which becomes resistant to insulin's effects independently of your muscle and your fat tissue. When your liver is insulin resistant, it overproduces triglycerides and packages them into VLDL particles that circulate in your blood. At the same time, HDL particles, which help remove cholesterol and have anti-inflammatory properties, they become depleted. This ratio of triglycerides to HDL is actually one of the most predictive markers for insulin resistance. If you divide your triglyceride level by your HDL level and the result is above 3, well, that strongly suggests that you are insulin resistant even if your fasting glucose is completely normal. This lipid pattern also increases cardiovascular risk more than LDL alone. Yet, it is often overlooked in standard health assessments. Dr. William Lee often emphasizes looking at the whole picture of vascular health, and this lipid ratio is a key part of that picture. It tells you about the quality of your fuel metabolism, not just the quantity of cholesterol. High triglycerides indicate that your body is struggling to process the energy you're eating, turning excess sugar directly into fat in the liver. Now we come to something that causes enormous frustration: difficulty losing weight despite actually trying, despite eating less, despite eating more, doing what you are told should work, yet seeing minimal or no results at all. This is not about motivation or discipline. Insulin is one of the body's most powerful regulators of fat storage, storage, and when insulin levels are chronically elevated, as they are in insulin resistance, your body is biochemically locked into fat storage mode. Insulin actively blocks an enzyme called hormone-sensitive lipase, which is responsible for breaking down stored fat. So even when you create a calorie deficit through diet or through exercise, your body struggles to access its fat stores for energy. You might lose some weight initially, but then progress stalls, and what little you do lose tends to come back quickly. Beyond that, insulin resistance affects your metabolic rate. Your mitochondria, which are the energy factories inside all of your cells, become less efficient at burning fuel. Your body shifts towards using glucose rather than fat for energy. And because glucose is not getting into the cells properly, your overall energy production drops. You feel more tired, you move less without realizing it. And then your resting metabolism slows down. Weight loss is not just about calories in versus calories out. When your hormonal and metabolic signaling is broken until insulin sensitivity improves, fat loss becomes extraordinarily difficult, which explains why so many people go through cycles of dieting, temporary fat loss, regain, and feeling like their body just will not cooperate. Dr. Jason Fung, a leading expert on fasting and insulin, argues that obesity is a hormonal disorder, not a caloric one. If you try to solve a hormonal problem with calorie counting alone, you are fighting a losing battle against your own physiology. You need to lower the insulin levels to unlock the fat stores. Moving on to sign number 7, which affects your mental clarity. Persistent brain fog, poor concentration, memory difficulties, or just feeling like your thinking is slower than it used to be. Your brain is an incredibly energy-demanding organ, using about 20% of your body's glucose, despite being only 2% of your body weight. And here is what matters. The brain needs a steady, reliable supply of glucose to function normally. When you are insulin resistant, your brain's ability to take up and use glucose becomes impaired. Insulin receptors exist throughout the brain, particularly in areas involved in memory and learning, like the hippocampus. And when those receptors stop working properly, cognitive function suffers. This is not just about a temporary fogginess after a poor night's sleep. We are talking about a chronic decline in mental sharpness, word-finding difficulties, struggling to hold information in your working memory, taking longer to process information, or losing your train of thought mid-sentence. It is frustrating and often dismissed as stress or aging. But emerging evidence shows us that insulin resistance in the brain, sometimes called type 3 diabetes, is a significant early contributor to cognitive decline and possibly even Alzheimer's disease. The brain becomes metabolically inflexible, losing its ability to switch between glucose and ketones for fuel, and your neurons become less efficient. What you are experiencing as brain fog is actually an energy crisis at the cellular level in your brain, and it is driven by the same insulin resistance affecting the rest of your body. Dr. David Perlmutter, a neurologist, has written extensively on how blood sugar control is the cornerstone of brain health. Protecting your insulin sensitivity is protecting your mind. Sign number 8 takes us back to blood tests, but this time looking at markers that might be labeled normal, even though they are telling you something important. The standard screening for diabetes in the UK and the US is fasting glucose and HbA1c, or A1c, which measures your average blood sugar over the last 2 to 3 months. The problem with this is that these tests are designed to diagnose diabetes, not to catch insulin resistance years before diabetes develops. Your fasting glucose might sit at 5.6 or 5.8 or 101 to 104 in the US, technically within the normal range, but at the higher end. Your HbA1c might be 40 or 41 in the UK or 5.8 to 5.9 in the US, just below the prediabetes threshold of 42 or 6 in the US. Your doctor looks at these numbers, sees that they are within range, and tells you there is nothing to worry about. But what these tests do not show is what your insulin is doing. Someone with good insulin sensitivity might have a fasting glucose of 4.5 in the UK or 81 in the US with an insulin level of 3 or 4. Someone with insulin resistance might have the same fasting glucose but need an insulin level of 15 or 20 to achieve it, 4 times higher. The glucose is normal because your pancreas is working overtime to keep it there, pumping out more insulin. Very few doctors routinely check fasting insulin, but it is one of the most useful early markers. If your fasting insulin is above 10 or ideally above 7, then that suggests insulin resistance even when glucose is fine. Similarly, if you are tracking your own blood tests over several years and you notice that your fasting glucose or your HbA1c is gradually creeping up, even within the normal range, then that trajectory matters. It is a signal that your metabolic control is slipping long before the official diagnosis. You have to advocate for yourself and ask for these specific tests because standard panels are designed to catch disease, not prevent it. And finally, the last point brings us to 2 conditions that often seem unrelated to blood sugar problems, but are deeply connected to insulin resistance: high blood pressure and fatty liver disease, particularly when there is no obvious explanation for either of them. Insulin resistance directly causes sodium retention in your kidneys. Under normal circumstances, your kidneys excrete excess sodium, keeping your blood pressure regulated. But elevated insulin tells your kidneys to hold on to sodium, which increases blood volume and raises blood pressure. This is why hypertension and insulin resistance so commonly occur together, a combination that significantly increases your risk of cardiovascular disease. Yet, when someone presents with high blood pressure, the focus is usually on treating the blood pressure itself with medication without asking why it developed in the first place. The same applies to fatty liver. Non-alcoholic fatty liver disease has become extraordinarily common, affecting up to 1 in 3 adults in developed countries. When the liver is insulin resistant, it continues to produce glucose and fat even when it should not. Excess glucose gets converted into triglycerides, which accumulates in the liver cells, causing the liver to become fatty and inflamed. This can progress to fibrosis to cirrhosis and then even liver failure. Yet, in the early stages, many people have no symptoms at all. It is often discovered incidentally on an ultrasound scan or when liver enzymes come back elevated on blood tests. The crucial connection is that both hypertension and fatty liver are downstream consequences of the same upstream problem, which is insulin resistance. And treating them in isolation without addressing the metabolic root cause means that you are managing symptoms but not reversing the underlying condition. You cannot put out a fire by just removing the smoke. You have to address the source of the heat. What all 9 of these signs have in common is that they are not isolated problems. They are different expressions of the same underlying metabolic dysfunction. Insulin resistance does not just affect one organ or one system. It is a whole body energy problem. It affects how your fat tissue stores and releases energy, how your liver handles glucose and fats, how your blood vessels respond to stress, how your brain functions, how your kidneys regulate fluid, even how your skin cells behave. That is why someone with insulin resistance rarely has just one symptom. They might have abdominal weight gain and high blood pressure or brain fog and food cravings or difficulty losing weight and skin tags. The pattern recognition is what matters because these signs cluster together in predictable ways. So if you are recognizing several of these in yourself, the important thing is to understand that this is not a personal failure. You have not done something wrong. Insulin resistance develops as a mismatch between the environment that we live in, with constant access to processed foods, sedentary lifestyles, chronic stress, poor sleep, and the biology we evolved with. Our bodies simply were not designed to handle the metabolic load that we are placing on them daily. But the encouraging part of all of this is that insulin resistance, particularly in its early stages, is reversible. Your cells can regain their sensitivity to insulin. The damage does not have to be permanent. So what should you do if several of these signs resonate with you? Well, the first one is understanding that early action is everything. The longer insulin resistance persists, the more damage accumulates and the harder it becomes to reverse. But if you are catching it now, whilst your blood test might still look normal, you are in an ideal position to change course. The foundation of reversing insulin resistance comes down to four core areas: what you eat, how you move, how you sleep, and how you manage stress. On the diet side, the focus is not on calorie restriction alone, but on stabilizing blood sugar and reducing the insulin burden. That means prioritizing whole, minimally processed foods, reducing refined carbohydrates and added sugars, including adequate protein to support satiety and muscle mass, and not being afraid of healthy fats. Dr. William Li advocates for eating foods that are rich in angiogenesis inhibitors and metabolic support, such as leafy greens, berries, and healthy oils. These foods help repair the body from the inside out. Movement, particularly resistance training, and even just walking after meals, dramatically improves insulin sensitivity by making your muscles more receptive to glucose uptake. When you contract your muscles, they can soak up glucose without even needing as much insulin. This is a powerful tool that is often underutilized. Sleep is non-negotiable. We know that poor sleep independently drives insulin resistance, regardless of your diet or your exercise levels. When you are sleep deprived, your cortisol rises and your insulin sensitivity drops the next day. It is a direct physiological link. And finally, stress, particularly chronic unmanaged stress, raises your cortisol levels, which we know directly worsens insulin resistance. Stress management is not just about feeling calm, it is about metabolic protection.